Okay, so Clinic with a Heart. I'll tell you everything you want to know, and I leave time for questions too, and it was really helpful to hear where everyone's from. So all ages, all walks of life. So you can ask me anything you want to know about Clinic with a Heart, and I'll try to incorporate some of what I learned from the introductions. So a lot of times when you think of a free healthcare clinic, and that's what we do, is free healthcare, you think of caring for people who are uninsured, but one of the phenomenons we're seeing is more and more adults, more and more people are underinsured. So, and I'm actually one of those people. I have insurance, I can't afford to use it. So my deductible is $6,000 a year, and there's no insurance until the $6,000 kicks in. And actually we have paid $6,000 this year. So there's a lot of people that a copay or a deductible is keeping them from getting health care. So people who are underinsured can come to Clinic with a Heart too. So it's not just for people who are uninsured. Another thing that's going to happen in Lincoln, Nebraska and in the United States, which will make access to health care even more difficult for us all, is a shortage of physicians. I don't know if any of you have tried to get a new provider in the recent past, but it is hard to find a physician who will take your kind of insurance or your circumstance. So the physician shortage is already here, but 100,000 physicians we will be short of by 2030. That's a significant impact on healthcare. Changes healthcare delivery. But there's other healthcare workers that the United States will be short of, which will make access to healthcare difficult, even with reimbursement. So home health aides, and some of you probably experience that, medical and lab technologists, nursing assistants, and nurse practitioners who are also providing primary care. So one of the things people don't know or surprised about in a country with excellent health care is that there is a need for 1,400 free clinics in the United States. There probably could be more than that, but there are at least 1,400 free clinics in the United States. Free clinics are sneaky and aren't necessarily registered anywhere, so there's probably more. These are all agencies that belong to the National Association of Free and Charitable Clinics, and we belong to that organization. So their headquarters is in Washington, D.C., and the executive director for the National Association of Free Clinics is actually advocating for free clinics to politicians, trying to make sure they know there is this portion of America that does not get health care. We need to look at what they need too. So if you don't know Clinic with a Heart, we are totally free health care, so there is no charge, and patients are often, when I talk to them on the phone, is this for real? What's the catch? So they're always looking for where I'm going to end up charging them. The visit's free, the medicine's free. If they get glasses, that's free. If they get crutches, that's free. It's free. We don't know how to send a bill. Unless you're a donor, we can send you an invoice, but we don't know how to send a bill for services rendered. We offer, and we're on 17th and Sumner, so if you've never heard of Clinic with a Heart or don't know about it, 1701 South 17th Street by Grateful Bread. A lot of people know that landmark, so our sign does not say sorry, we're open, though. It says we're happy we're open. So we offer medical, dental, physical therapy, chiropractic, mental health, vision, hearing, and spiritual care. So a variety of services. We're an urgent care clinic, and I'm going to talk more about that. But in addition to our basic services, we also have expanded through the years in specialty care that we're able to provide to patients. So we have an allergy and asthma doctor that our patients can go to, and actually he doesn't serve at the clinic, he serves in his office. If you've ever gone to an allergy doctor, they do lots of tests and lots of scratch tests, and he doesn't want to schlep that all to the clinic, so patients go to his office. But we can refer patients to him. He'll see them for free, he'll use our paperwork, and it will end up back in their medical record at Clinic with a Heart. We have a dermatology clinic that's an ad hoc dermatology clinic. That just means the dermatologist calls me. His daughter is a med student. When she's in town, he'll call me and say, she's in town, let's have a dermatology clinic. So that's what I mean by ad hoc. So those are generally on a Saturday, and when his daughter graduates, I imagine we'll be able to have them even more because she'll be in the practice. We have a diabetic clinic. There's a community coalition that talks about how we care for people without insurance with diabetes, and that coalition actually developed the diabetic clinic at Clinic with a Heart. Anita and Ashley actually come to the clinic on the fourth Monday of the month to see our patients and to connect them with other services, so collaboration is a key. Our only chronic care clinic is our hypertensive clinic. So we started that last January, and so we limit our medical visits to patients to 3 times in 12 months, unless you're in our hypertension clinic. Then they can come until circumstances require that they go to a different setting. So we're still not a medical home, but we're at least seeing them for their hypertensive needs throughout their care needs. Unless they become ill with other circumstances, then we'll connect them with a different medical home, or sometimes they graduate with insurance and then we get them into a primary care provider. Unfortunately, one of the biggest dental needs we see for people without insurance is extractions. So the teeth have already gotten so bad they can't be saved. So we also started a year ago a dental extraction clinic. So that is through a referral from us. So people come on Tuesdays for exams, and then Thursdays or Wednesdays we schedule them for extractions. And we've pulled about 1,000 teeth. That's a horrible metric, but that's the reality of what the need is. And we recently started a pain management clinic, which I'm really excited about, without opioids as the manager of the pain. So we have a physician, he does injections, a lot of injections. He works with our diabetic clinic and our orthopedic clinic, and tries to get people, and migraine headaches. So those are the 3 things he focuses on at the clinic. So if you know anyone who needs any of these specialty services, they start at our walk-in clinics. I believe there's a schedule in your packet. If not, clinicwithaheart.org has our schedule. We have walk-in clinics every Tuesday and Thursday. It was a separate handout. Every Tuesday and Thursday, and then on the first Monday of the month. And that's the gateway to all these specialty services is through the walk-in clinics. So Clinic with a Heart is a free clinic that is for everyone. So there's not a lot of barriers to getting the care that we need. We don't qualify patients to be seen. So people don't need to bring their identification with them. And all our care is provided by volunteers. And that is a thing we see a lot, is people come up to the front desk and they've got their packet of information and they're ready to show us their W-2 forms and ID, and we don't need it. The only thing I ask patients is that you use the same name every time you come so we can pull your medical records. So I know some patients don't even use their real name when they're at the clinic. Our role in the healthcare the safety net is we're an entry point for people who have not had health care for usually a long time. Most of the people we see are my age, so 19 to 64. Now you know how old I am. Most of them are my age. So kids have Medicaid and older adults have Medicare, but if you're my age and you don't have insurance, it is really hard to find the help that you need. So we're an entry point back into healthcare. We're going to connect people with all of you to help them get additional resources too. This year we're focused more on social determinants of health, and that's just going to grow. So we're looking at beyond people's health concerns, what are the other concerns that are barriers to healthcare, like safety and food insecurity and connection with other people and all those other things. So we actually are assessing that now. We have a PhD student who's doing a project that's we're learning a lot. We were all geared up to help with safety, thinking safety would equal domestic violence, and we're finding safety is a much bigger question when people are answering that. So we're seeing a lot of people who are homeless who identify safety as a huge barrier for them because they're just afraid of where they're sleeping at night. So that's been very eye-opening. We're urgent care, we're not a medical home, so we're not going to keep a patient unless they're hypertensive. We're not going to keep a patient coming to the clinic every month for health care. We're going to help them find that medical home. Chances are it's going to be Health 360 or Blue Stem Health, which you'll hear from later on. Those will probably be the medical homes we'll refer to. But there's others in town too. So we work with lots of partners who help figure out what's the best medical home for a patient's circumstances. And we're a gateway to lots of other resources. And looking at social determinants, that gateway role is even growing more. It's always good to know things we don't do. So if you're sending patients to us, you know not to send them if they're having a stroke, a heart attack, or blood is gushing out of them. Do not send them to clinic with a heart. So we do not provide emergency care. We do have people who are so afraid of a bill, they'll come and they'll be having a heart attack. And fortunately, we have a nurse there when the clinic is getting started, and we will send them to the emergency room. But it's not good to hang out and wait and have your heart attack later. We do not prescribe any narcotics, controlled substances, or antipsychotics at the clinic. So that does impact who we can and cannot see. And part of that is all the care is provided by volunteer. We don't have the ability to manage the care that requires this level of medicine. We do not do STD testing or treatment right now. A goal is that we do start doing that. So if anyone wants to partner with Clinic with a Heart, let me know. But that is something I hope. One of the things when we start a clinic, we announce what we don't do to patients just so they don't wait for hours. And I will have people, when we say we don't do STDs, they'll go, oh man, and then they'll get up and leave. It's not my HIPAA. We don't treat hepatitis, so we would refer for treatment for hepatitis, tuberculosis. We don't do dental cleanings, and that is a goal that we will eventually be able to clean the teeth. Right now, we pull the teeth. We don't clean the teeth, but we do want to get more proactive about dental care. We're working backwards. Next year, we'll be doing restorative care, some fillings and those kinds of things, and then we'll get to cleaning. We don't do immunizations. Fortunately, the Lincoln-Lancaster County Health Department is a great partner, so they do come to the clinic and provide immunizations about 4 times a year. We have 2 childhood immunization school physical clinics that they come to, and then 2 adult clinics. One was actually last Monday, and then one is the first Monday in November. We don't do pap smears or mammograms, so we'll refer patients to Every Woman Matters or other programs depending on their age or circumstance. We can tell people if they're pregnant, but we don't manage the pregnancy. So when someone finds out they're pregnant, we will refer them to presumptive eligibility. We don't do Department of Transportation physicals, and that one's kind of a bummer to me, but a provider who signs off on a Department of Transportation physical assumes liability. If that driver were to have a heart attack down the road, the attorney comes back and sues the physician who saw them. So we try to protect our volunteers who provide, and unfortunately litigation is something we all have to think about in our jobs. We don't do companion animal physicals. We've had some very unfortunate circumstances with these physicals because the provider can say the person needs one, but we don't know that they have 2 pit bulls that are untrained that don't know how to live into an apartment. And so we've had a lot of landlords get mad at us about companion animals. We have lots of partners we work with to help us help our patients find permanent medical homes. Like I said, we're urgent care, and that medical home is such an important role. Probably a lot of you have a medical home. I've gone to the same doctor for 30 years. That doctor knows more about me than anyone on earth. But that's an important relationship. So he's able to see the trend of my health, not just the snapshot of my health today. So he knows if I'm fatter or skinnier, if my blood pressure is higher or lower, if I seem more depressed or less depressed, because he's seen my whole picture. So that's such an important role, having a medical home. So the Lancaster County Medical Society is a great partner in helping our patients find a medical home, or any of your patients. 402-483-4800. I give that number out so much, I remember it. But they know what providers are taking new physicians, what providers fit best with the patient's insurance status, those kinds of things. Aging partners will work with a lot of our clients, and they're on our referral sheet, so those clients who are older adults. And actually one of the aging partners workers is a team leader at Clinic with a Heart, so that really helps that relationship. Barb Strauss. El Centro de las Americas, about 17% of our patients are Spanish speakers, so we'll refer them to El Centro to get help navigating to that medical home. The Veterans Administration, not a lot of veterans come to Clinic with a Heart, and really that's a good sign that they have access to services other places. But we do see about in a quarter about 17 to 20 veterans who come to the clinic, so we'll connect them with the VA and other resources. And then people come to us from any county, so there's no barrier to by what county you're from. So if a patient needs a referral, a lot of times we can't refer them to services in Lancaster County if they're not from Lancaster County. So we'll refer to county health departments, and they're all different how they're structured, but they've been great resources for patients that get referred. Public Health Solutions, thank you for all you do with our patients. So this is just a little snapshot of who our patients are if you've not been to the clinic. 84% of our patients are over the age of 18, and like I told you, they're my age, and that's because of the access to a benefit. 16% were minors, and most of the minors that we see, it happens in August, and it's for school and sports physical. So if you came to the clinic in August, I'm sorry, it's not usually that crazy and that loud. It's a wild, wild place. But they could be families that are new to Lincoln, Lancaster County, and they haven't established a medical home. Their Medicaid hasn't transferred yet, or they called their primary care doctor a week before school, and guess what? The office is booked out 6 weeks. So they came to Clinic with a Heart, and we want to help those kids get into sports and get into school. Our volunteers last year provided 3,911 visits to 3,200 people, and we're past that already this year. So the need has grown. Part of that is the People's City Mission closed their medical services at their free clinic, so we saw a little bit of an onslaught of patients when that clinic closed. 93% of our patients were uninsured, and actually that number is creeping down. Like I said, we do serve people who are underinsured, and I expect the uninsured portion to creep down. So with Medicaid expansion, I hope it creeps down quite a bit, but that's something we watch carefully. One of the important benefits to the community of having a free clinic is keeping people out of the emergency room who don't need to be in the emergency room. So we ask every patient, how likely would it have been that you would have gone to the ER if you wouldn't have come here? So 42% would have been likely to go to the emergency room. And when you think about if you've been to an ER and you don't triage to the top, it can be a long wait in the emergency room. So this reduces the wait for us all. It also is a benefit in terms of reimbursements. So I would say probably of the people that would go to the ER, most couldn't pay their bill. So it's probably about a $42,000 benefit in terms of reimbursement, at least. My last ER bill was $3,000. 70% of our patients spoke English as their primary language and 17% Spanish. We do use interpreters. We have 3 Spanish interpreters at most clinics. We try to have 3 Spanish interpreters at most clinics. We generally will have an Arabic interpreter, and then we'll use Language Link and then the MARTI system. So we have technology that's also helping with interpretation services, and that need seems to be growing even greater, and it's very expensive, but that's a growing need at the clinic. Last year there were 24 different languages spoken at Clinic with a Heart, and you know, I sit there and do the data. I'm the nerd at work, so I actually verify that, oh, I've never heard of that language, and I'll Google it and make sure it's a language, and I'm learning a lot about the world. 8% of our patients did not speak any English at all, so often that'll be a refugee or immigrant brand new to the country, or they're here on a visa visiting their family, brand new to the country. Can you imagine how scary and difficult it is to navigate healthcare? It's difficult and scary if you speak English, but if you don't speak English, it's terrifying. So having those language services available is an important benefit. 16% of our patients identify themselves as being homeless in the last year, and I imagine it's even higher than that. We just ask, are you homeless? We don't ask, do you own your own house? Do you do you have your name on a lease? We just, are you homeless? We are changing with our Social Determinants Project how we ask that. When our providers write a prescription to a patient, it is free to the patient. Now, the parameters of prescriptions written at Clinic with a Heart is it has to be something on our formulary. If you have insurance, maybe your insurance company sent you their formulary. Formulary is really the list of medications that can be prescribed. So ours is managed by our pharmacy director and our medical director. What's on the formulary, it's driven by the level of care that we're able to provide. So we're always very humble about what can we do at Clinic with a Heart, and we're not prescribing beyond what we can provide with the healthcare providers. It must be written on a Clinic with a Heart prescription pad, so our providers may have their own prescription pad. They can't write a script when they're at our clinic on their prescription pad, because a lot of times patients will want to negotiate with them about, well, would you just write me this Viagra prescription that's not on our formulary, this Viagra prescription, and I'll pay for it myself, but I just want a prescription. No, the answer is no, because that patient's going to come back and want it refilled, and guess what? It's still not on our formulary. We give a 30-day supply when we write a prescription, unless it's for our hypertension patients, but a 30-day supply. So the patient, remember I said they can come 3 times in 12 months. They have to come back for another visit if they need a refill of a prescription, and they can do that 2 more times. So finding that medical home becomes very important, and we're talking about it at every visit that a patient has. We do have a lab, and most of the lab work we do is the results are available while the patient's there, because like many of you, we can't find our patients tomorrow. So doing as much as we can while they're there is very important. We do A1C, so that's to determine if they're diabetic, a glucose test, pregnancy tests, and that's a urine pregnancy test. Strep test, so this time of year we bulk up on those supplies. A urinalysis. And then for our hypertension clinic, we'll also do a blood draw. So, but that's the only clinic we do blood draws, and we use a UNMC lab to analyze the results. So now everything you've wanted to ask about Clinic with a Heart, but we're afraid to ask, I'll take questions. Okay, so what are our mental health services like? So, and I would call it mental health light. So we do not have psychiatry services, and that's one of the reasons we don't prescribe antipsychotics too. Generally what our counselors are doing, or the licensed mental health professionals are doing, is a light intervention with someone, helping them figure out how they're going to handle a problem, but it's not long-term counseling. We'll help them, refer them to long-term counseling resources. We do have some volunteers in the community who will see people in their office for 3 additional visits, and they'll do that for free. But it is a short-term intervention. So if they have a chronic mental health issue, we're going to try to get them Lutheran Family Services or another community resource other than Clinic with a Heart. So a lot of times it's families in crisis. They just lost their home, or they're having a divorce issue, or those kinds of things, and they're just trying to figure out how are we going to manage this situation. Do we do eye exams and glasses? So we are actually changing, we've been doing an experiment for the last 3 months of how our vision program works. The answer is yes, but we no longer have our eye doctors coming to the clinic to do the exams. The patients come and we give them a voucher. We were getting to the point where it was really hard to get someone to volunteer at Clinic with a Heart for eye exams because our equipment is, the Brady Bunch probably had their eyes examined on that equipment. Eye equipment is very expensive, very high tech, and very persnickety. So when you go from practice to practice, they all have different equipment, and they'd see ours and they're like, I can't do this. So now we do vouchers to their office, and the patient comes back and gets the glasses from us. So that's kind of the deal we've struck. We've expanded. We were getting so low on volunteers that we were only doing 6 eye exams a month, which isn't very much. So now we're up to 24 a month, and that will grow because it's actually, the experiment's going really well. I love it when that happens. So the patient still comes to Clinic with a Heart on vision night, and that's when we hand out the vouchers. The vouchers do have some income requirements, and they have to have no eye insurance. So if they have eye insurance, we wouldn't give them a voucher, and it's the honor system. We have pastors. So every night we have a clinic. It's a mission team from a faith community. So that's a good question. I didn't explain that well. So there's 7 churches, a temple, 2 hospitals, and 2 teaching institutions now that come to the clinics, and they come once a month as a team. And they'll bring their own chaplain or pastor. It has to be someone licensed in spiritual care. And it's like a hospital chaplain role. So that person is with patients offering to pray. We don't proselytize at the clinic. We're not trying to convert people. They're just offering to meet people where they are. If they want a prayer, we'll pray with them. If they want to talk about resources in the community to develop spiritually, they'll do that. And that's why they have to have a license too, because you'll hear some pretty heavy stuff when you're a pastor. We also have a prayer box, and patients add prayers to that every night at Clinic. And because I'm a nerd, I have them all in a database that I share with actually chaplains all over the city who pray for our patients. And the prayers tell as big a story about our patients than anything else, what they're praying for. Yeah, so that's why we now have someone called a Referral Coordinator at Clinic with a Heart. So she's at every single clinic helping manage it. Are you giving me a time thing? Okay. See Jeff on the side there. So Crystal's our Referral Coordinator, and she's helping to manage that. And there's really 2 tracks with specialty care. So if it's one of the specialty services I listed, those are our services we're providing. So we're just going to give them an appointment and then tell them where to go. Allergy and asthma is the only one that's off-site. The others are back at Clinic with a Heart. If it's something that's wasn't on that list, like they need to see a neurologist or a kidney doctor or something not on that list, then we're going to work with Anita and Ashley to see, do they qualify for general assistance or a program that would reimburse for those care, and then the Lancaster County Medical Society to get them an appointment but it's not free. So it's no longer free when that happens. When it's to us, it's free. When it gets outside our walls, it's no longer free. Now, the doctors in our community have agreed to take patients at a Medicaid rate, which is a much lower rate, and the Medical Society will help them navigate through that. How often are we full? I would say we fill up probably 90% of the time now, and that's been new in this last year that we were full. So what we do is on clinic days at 2 o'clock in the afternoon, we hand out numbers to people in the order that they arrive. And I mean, ringing the doorbell and knocking on the door doesn't make it happen faster. 2 o'clock is when it happens. Our Director of Patient Services manages that process. We give people a number. The number gives them a return time that's 4 o'clock or after. So we used to actually ask people to wait, but because of safety concerns with the number of patients we're seeing now, feel free to leave just to keep the crowds down, because that helps with the anxiety levels. So people have return times that are 4 o'clock, 4:15, 4:30, 4:45, depending on what number. So that also spreads out the wait. And then it does generally take, it's not a 20-minute visit. It does generally take, once they're admitted into the clinic, at least a couple hours to go through the clinic. And I wish it was faster, but we're trying to see a lot of patients in a short amount of time. And I went to the doctor yesterday and it took me 3 hours. So I'm like, well, I guess we're not as bad as I think, because I was in different private rooms a lot, unclothed, but the Lincoln Lancaster County Health Department is helping with flu shots. So on the first Monday, they'll have the adult immunization clinic, and that will include flu shots. And then what may also happen is a lot of businesses in town will do flu shots, and they'll have too much vaccine, and they'll call us and say, do you want the vaccine? And then we'll take it, and we'll do flu shots too. And we'll announce that when it happens, yeah. If you want a tour, if your agency would like to have a staff meeting at Clinic with a Heart, I'd love to show you what it's all about. If you have a partnership idea, I'd love to hear about that too. So thank you very much.